So if you have blood work, go grab it. If you don't have blood work, take notes so that when you get blood work or when you can go get access to your blood work, you can see this. Okay. Now, the two markers are going to be found inside the CBC with differential. Now, this is my lab test worth the price of gold if you know how to read it correctly. You must have the differential portion with that CBC. Most of the time, physicians order it. Sometimes they don't, and I just check the right box, please. So, at the very top of this lab marker, this lab, you're going to see a marker called the white blood cell count. Okay. When you see the white blood cell count or the WBC, you know you're in the right spot. You're going to scroll all the way down until you see the word neutrophils. This might also be called granulocytes. And then right below it, you're going to want to know the word lymphocytes. Those are the two most important markers that you need to know in all of your blood work. Okay. Why? The neutrophils, these guys, they tackle bacterial infections. That's their main job. Okay. Lymphocytes, they tackle viral infections. That's their main job. The magic number for the neutrophils is 60%. Make sure it's the percentage form, not the absolute value form. We want the percentage. That's what does the math easily. Okay, if it's less than 60%, it's probably a good thing. If it's greater than 60%, we got a problem. Your body's fighting some bacterial infections. Okay, now this can look like literally, I had a patient with a 88% neutrophil count and she had frozen shoulder syndrome, meaning she couldn't use her shoulder. And all treatment into her shoulder failed. I tackled the bacterial infections with some supplements, shoulder's just fine. Her mood is fat balanced. I mean, there's so much more than just her shoulder. Okay. Bacterial infections often lead to joint pain and gut problems. Gut problems like IBS, IBD, Crohn's, ulcerative colitis, or I have gut problems and nobody can tell me what's causing it. Here they are. Okay. Viral infections, the magic number for lymphocytes is 30%. If it's above 30%, your body's fighting some type of viral infection. I don't care what it is. Use an antiviral, support the immune system. This is the most common cause of chronic fatigue. If you're battling chronic fatigue, you're not going crazy. It's not because you need an antidepressant or an anti-anxiety pill or have chronic fatigue syndrome, whatever the crap they want to call it. It's because your body's fighting a low-grade viral infection and it doesn't have energy for anything else. It's also the number one cause of autoimmune diseases, the number one cause of anxiety and depression. Okay. Now, these two are the most important markers, not only for this reason, but for this other reason. Pay very close